My experience as a woman and a Latina in medicine has been unique. I really do feel the weight of being a beacon for my community, for future generations. But also, I have found it really rewarding even when patients have the awareness that they're being taken care of by someone who is a rarity in the US in medicine. I love taking care of all my patients, but there's definitely a little bit of a more special connection when it's someone who really appreciates having similar cultural or language similarities and can connect in a different way where perhaps they may have been a little bit more apprehensive of the healthcare system, but you're able to bring that sense of confidence in the system and being able to engage them, and they're able to trust you a little bit more. I certainly try to bring that bedside manner to all my patients, but I think that recognizing the disparities in healthcare, it's something that I sense a little bit more when I'm taking care of patients who are women or Hispanic, Latino, or really any other minority in medicine. Inclusive excellence in medicine and surgery has really evolved over the last 5 years. We saw a lot of positive energy since the events of 2020, and I really think that medicine and surgery have cemented the commitment to make our field more inclusive and really help everyone thrive so that we can provide excellent care to our patients, so that we can make advances in medicine and surgery. And really, it's about helping everyone become the best physician and surgeon that they can become. I would love to see more diversity in surgery. I would love to see more cultural dexterity, meaning have everyone be able to provide excellent care regardless of background. And it really comes down to a little bit of bedside manner, a little bit of meeting people where they're at. There are many areas where we can pursue more research when it is focusing on the Hispanic and Latino community. We know that there's a lot of disparities, and some of these are really based on access to care. However, we have recognized that there are unique scenarios where even though we see a different level of access to care, we actually see better outcomes, and that is something unexpected. We call it the Hispanic paradox in our medical surgical literature. I think there's a lot to be said for learning what are the factors that are protective. In addition to that, we want to also recognize that there may be biological differences in disease based on origin. And so until we get more patients represented in research, we're not going to always know whether medical or surgical problems are affected by the healthcare system, by differences in biological disease. And currently, we don't have a lot of patients represented to where we can make strong conclusions about their care and their health. My advice to young Latinos looking to pursue a career in medicine and surgery would be to really just give yourself a shot. Try everything, look for mentors, look to your community, to your family for support and the resources that you need to really be successful. Don't be afraid to fail and ask for help. Load the boat. This is a marathon, so make sure that you're ready for the long path ahead. AI is a really exciting tool in healthcare, and I think that in my practice, I'm looking at it in terms of helping me become more efficient so that I can reduce the amount of administrative time and increase the amount that I can spend with patients learning about their background, their disease, and how I can best serve them, particularly in very difficult and stressful episodes of care, which is what we consider surgery. So I'm really excited about the way that AI can help us not only reduce the time we spend, for example, on writing clinical notes, but also discovering how it can help us in decision-making algorithms and diagnostic accuracy. So I'm really excited about the prospect of AI in healthcare.